But I have alleged, as you know, for some time that it would just be a matter of time before any kind of relaxation of these very stringent measures would result in a return of the virus. And I think that's what's happening. It clearly is happening in those other Asian countries that we have put so much stock in as to they know how to do it, including Singapore, Japan, and Korea, Hong Kong. Look at all of them right now with big increases in case numbers. Singapore last week actually declaring a national state of emergency. Japan this past weekend declaring that 7 prefectures were now states of emergency. This is really evident of what we've been saying all along. Trying to stop the transmission of this virus is like trying to stop the wind. So clearly you can do a number of things to reduce transmission, but you're not going to get rid of it. And so people who use these Asian countries as models have to ask themselves, if we want to do this, which, it makes good sense from a public health standpoint in terms of reducing case numbers, you're going to have to really have quite remarkable and comprehensive control measures in place that I don't think are actually doable in most of the world. And so that's where, again, I come back to what do we need? Most of all right now, we need a national plan. How are we going to thread the rope through that needle? How are we going to decide we can't go in total lockdown, but we can't also just say, okay, go back to normal? How do we bring back society in a way that is still challenging that virus in our virus versus human battle, but at the same time also recognizing the reality that we have to get back to a societal norm, if there is such a thing, that allows essential services and other parts of the economy to expand.